Hi, my name is Allison McBrayer. I'm the Joint Replacement Coordinator for North Mississippi Medical Center. My goal is to provide you with the information you will need in order to have a successful joint replacement surgery. You will be given a patient education guide that has some very useful information in it. I hope that you will use this video as a supplement to that book to help guide you along your journey to your recovery. First of all, we would like for you to ensure that you are going to be safe at home once returning after surgery. You will need to go ahead and designate a person that will be able to stay with you on the night of surgery to ensure that you are safe after having anesthesia. That person will also need to be available in the following days to help with you with your daily activities, help you with your exercises, and also provide transportation to and from physical therapy. If you feel like you do not have a designated person, please discuss that with your surgeon prior to surgery. Also, we would like to make sure that you do have a standard rolling walker. This walker should have 2 wheels on the front with stoppers on the back. Our rehab team prefers that you do not use a rollator that has 4 wheels, brakes, and a seat due to safety concerns. Also, go ahead and take a look around your house and think about things that could be a fall hazard. If you have loose rugs laying around, extension cords across the floor, go ahead and let's put those up so that you will not be at risk of falling. Go ahead and get your walker out, walk around your house, make sure your walker will fit around your furniture. And then also, if you have a bedroom upstairs, we would suggest that you prepare a place to stay downstairs for about a week or so until you are more comfortable maneuvering stairs. Now let's take a look in your bathroom. If you have low toilets, we would suggest that you purchase a toilet seat extender. That will be very beneficial to you after knee or hip replacement. As far as a shower chair, those can be beneficial also, but it is not required, so that may be something you also want to look into purchasing. So as of today, I do want you to take your booklet out at home and go ahead and start working on the exercises that are in the book. This will help you to increase your mobility and strength prior to surgery, and then you will also do these exercises after surgery. 5 days prior to surgery, we would ask that you stop taking any aspirin, anti-inflammatory medications as Aleve, ibuprofen, things in that category, and some supplements that can thin your blood would be fish oil, turmeric, and vitamin E. If you are taking a prescription medication such as Eliquis or Plavix, anything in that category, you would need to discuss this with your prescribing provider so that they can give suggestions on when you would need to stop that medication. We would also ask that you begin drinking extra fluids between now and surgery so that you will be well hydrated when you come in. Stop any alcohol or tobacco, and ladies, don't shave your legs prior to surgery. We would not want you to have a cut that could harbor bacteria. I also would suggest that you pick up some antiseptic solution called Hibiclens. This can be purchased at any retail store or pharmacy. You would need to begin showering with that daily, 5 to 7 days prior to surgery. You will wash your entire body with this soap, excluding your face and private area. You will pay close attention to your surgical area. Let that sit on your skin for 2 minutes before rinsing off. We are just trying to take care of any bacteria on your skin. The day before surgery, our scheduling team will call you after lunch and let you know what time to arrive on the day of your surgery. Please do not eat or drink after midnight on the day before surgery. On the morning of surgery, please only take the medications that have been highlighted on your prescription medication list that was given to you at pre-admission testing. You will be asked by the nurses in short-stay surgery which medications you have taken that morning. Also, please avoid wearing perfume, lotion, makeup, nail polish, and jewelry, and please remove any piercings that you may have. On the morning of surgery, we would ask that you dress comfortably, wear loose-fitting elastic waist pants, shorts, jogging pants, sleep pants, anything that would be allowed to have bulky dressings underneath. We would ask that you wear tennis shoes. Our rehab team prefers that you do not wear slide-in shoes or flip-flops due to a fall hazard. Please bring your walker into the hospital when you report that morning, because we will have you walk in pretty soon. Bring your ID and insurance card, bring a list of medications, and if you use a CPAP machine at home, please bring that. And please make sure your name is on that CPAP machine. You will need to bring your coach. Many times your surgery will not be able to be performed if you do not have a person with you. When you arrive at the hospital on the morning of surgery, you will report to the outpatient admissions desk on the ground floor of the East Tower. They will check you in and then direct you to the second floor short stay surgery. A nurse will then guide you to a short stay holding room. You are allowed to have 2 visitors with you waiting in the short stay holding room. Your surgeon will come around and mark your operative area prior to surgery and answer any final questions. Someone from the anesthesia team will also visit you. They will discuss the options that you have for anesthesia. One option is general anesthesia. That would allow you to be put completely to sleep, where you would have a breathing tube. And then we do offer spinal anesthesia, which is more like an epidural anesthesia. So they will discuss those options with you, and you together will decide what is the best option for you. They will also offer you a nerve block. So you can have a nerve block in the hip or the knee, whichever your operative area is, and this will allow you to have pain control hopefully for about 12 to 15 hours after surgery. Once you're wheeled back to the operating room, surgery is about an hour to 2 hours, and then you will be sent to the recovery room for about an hour to be allowed to wake up, maybe drink something, have your pain controlled, and then depending on if yours is an outpatient surgery or an inpatient surgery will depend on where you will be transported then. If the plan is to go home the same day as surgery, you will be transported back to your short stay holding room. Physical therapy and occupational therapy will come pretty quick, get you up and walk you, go over all these safety things for home, showing you how to get dressed, get in and out of bed, go up and down stairs. They will even take you out to your car and show you how to get in and out of your car. Once you have been cleared by all their goals, you will be discharged. Now, if you're an inpatient, you will be transported to the 5th floor on our orthopedic unit. Depending on the time of day, physical therapy may actually see you that day. If the timing does not work out, they will see you the next day and go over these same goals before you're released to go home. So once you are home, we do want you to be up walking about every hour. This will help prevent blood clots and allow you not to be stiff from sitting. Other things that we want you to do to help prevent blood clots, we will give you compression stockings to wear. We will have you do what's called ankle pumps, and that is just pumping your feet back and forth several times a day. When you're sitting around watching TV, just kind of make a habit of pumping those feet back and forth to keep that blood flowing. Most of our surgeons also will have you take an aspirin regimen after surgery to help prevent blood clots. If there's a contraindication and you are not allowed to take aspirin, or if you're already on a blood thinner, please discuss this with your surgeon for other options. You should use ice packs several times a day on the operative area, but no longer than 20 minutes at one time. You should elevate your leg several times a day. When you elevate your leg, please put the pillows under your ankle and not under your knee, because that would block your blood flow. You will also be instructed on breathing exercises with what's called an incentive spirometer. You will be instructed by the nurses in short stay on how to use that, and this is just to help clear your lungs after anesthesia. Your surgeon will have sent you home with some pain medicine and a schedule on how and when to take that. You will follow your surgeon's instructions on when you may shower and change your bandage. Certain activities are restricted after joint replacement. These would be driving, returning to work, or returning to sports. Your surgeon will give you more direction on when you're allowed to do those things. We do ask that you not take a tub bath or soak in water until that incision is completely healed. We also ask that you avoid using any ointments, creams, or lotions on that incision until it is completely healed. For knee replacements, most of our patients will begin outpatient physical therapy the very next day following surgery. If your surgeon's clinic has not yet set you up for this appointment, please contact them so that they can do so. Hip replacements do not typically require outpatient physical therapy. You will just go home and walk and do those exercises in your book. Also, if you do not have a post-op appointment scheduled with your surgeon, please call his office to schedule that. If you have any complications after surgery, please call your surgeon's clinic. If they do not have an after-hours number, you may call NurseLink at 1-800-882-6274. And I just want to thank you for choosing North Mississippi Medical Center Joint Replacement Center, and I wish you the best on your journey through joint replacement. Thank you.